Post-op day 1. I'm going to run through, while I have a moment, kind of how the day yesterday went. My surgery was the first of the day, which is why I had very little filming of that. My mother took me, got all prepped for surgery, met the anesthesiologist, who was great, who recommended or who offered 2 types of blocks for me. What that means is giving you medication prior to surgery to kind of keep the nerves of the chest wall numb so that you have a lot less pain. Recovery is a little easier. Talked to me about 2 different types, a pectoralis block and an ESP. I elected to go for an ESP. I had talked to other anesthesiologist colleagues I had, and that's what they recommended. And so before the surgery, so in the pre-op area, he used an ultrasound to give me numbing medication into the nerves of my upper back that wrap around to my chest. It was uncomfortable. I had epidurals with both my babies. This is much more uncomfortable than that because it's in your upper back, just underneath your scapula. But almost right after that, I got taken to the operating room. I was lucky enough to have a nurse that I knew who took awesome care of me. And then I got wheeled into the operating room, which was such a surreal experience. I'm the one usually directing in the operating room, so to be the patient and to be on the table was very strange. And if I'm honest, unsettling, because you have so little control. And while I knew that, because I learned that in training and taking care of a lot of people and operating on a lot of people and talking to them afterwards, it's giving up control in a scenario, which is really hard. But I got to experience it and experience it in a way where I was going completely to sleep. I've had procedures before, but nothing where I had general anesthesia. I went to sleep and I woke up in the recovery unit and my mom was there. I said everything went well. I had a little bit of pain in the recovery area, but nothing terrible. I got 2 small doses of pain medication and then I was ready to go home. I went home really sleepy, came home, said goodnight to my babies, and passed out for the rest of the night. Today has been a little rougher. I've had a lot more discomfort and pain. I've been asleep a lot on and off today. I have pain medication, antibiotics, and things to take, which I've been doing, but my goal before starting all of this was to try and use the minimum amount of narcotics as possible. I don't like the idea of narcotics, but this is no joke. This is different kind of pain. So I've been okay, but if I gotta do what I gotta do, I gotta do what I gotta do. I'm not supposed to be moving my arms around a whole lot, so at the moment, since nobody's home, I can't show you what my dressings look like, but I will. At some point in the next day or 2, I'll have my sister come over to help me take pictures and stuff. I have kind of a makeshift bra, and then I have drains, and the drains are stitched underneath the skin to help not only determine if there's any unexpected bleeding inside the chest wall, but also to help drain some of that blood so that I don't get an infection or a hematoma or anything crazy like that. It's an interesting experience. My parents are not good at medical kind of stuff, so while they are very supportive and helpful, them emptying my drains is not going to happen. My sister was over here earlier for a small amount of time, and while she tried to help empty my drains, she couldn't complete it without feeling nauseous, so she gets partial credit. I mean, I have been able to do it. If I'm in a lot of pain, then one of them would step in. But my recovery is supposed to be about 6 weeks. The first 2 weeks, I'm not supposed to move my arms very much. Second 2 weeks, I'm supposed to be able to do a little bit more with my arms. And then after that, I will hopefully get back to normal, although I'm not supposed to lift anything over 5 pounds, which means no lifting up my babies, which is extremely hard when you have toddlers. It's okay. It's not horrible, but it's not great. It's recovery. What are you gonna do?